Yes, but now we do. I'm just going to cover a little piece that we were missing from last night's lecture, and we'll take it from there. We were talking about the passage, or the pelvis. Some landmarks there, but basically it is the picture that some people need. Pelvic shapes. The gynecoid, or the completely round opening, is the most ideal for vaginal childbirth. It doesn't mean that these other kinds can't accommodate a baby, but the baby has to be smaller than the widest part of the opening, or at least has to be lined up with the widest part. So gynecoid is definitely the preferred pelvic opening for childbirth.
The android looks like it could be painful, cause some damage on that point.
Yeah. And, I wonder if that is really what it's like. I'd like to see an android pelvis, like real image of it, as opposed to, I'm like, I wouldn't mind a little heart-shaped pelvic opening, as long as I'm not having child come through it.
Where did they have it on YouTube?
Yeah.
You should Google it.
Anyways. When we are referring and measuring the pelvic opening, we are naturally measuring front to back, antero, posterior, and side to side is transverse. The passenger. Now, the baby's head can tell us a lot, because that might be the only thing we can actually touch for a good bit of the labor and delivery process. And we are using landmarks like the fontanelles and the sutures. When we're doing a vaginal exam, we're using our fingers. It's a digital exam, and we can feel for those landmarks, and we can tell where and how the baby's head, if it's a head, is presenting in the pelvic opening. I have never missed a breech. That's wrongly said. I have never mistaken a breech for a vertex. Vertex meaning head down. Because I never say vertex or head down unless I feel sutures and a fontanelle. Because a hard surface, people think it's a skull bone. But a hard surface can be a hip bone or some other part of the body. I mean, elbow is a little more obvious, but I never say it is a head unless I feel for these landmarks. Just because I've seen too many other people make that mistake. So we are looking for landmarks and trying to figure out how, if it is a head, B, how is the head presenting in the pelvic opening. Just another view of this passenger, if you will. Vertex is what comes down first, and as it's making all its internal cardinal movements, it's the occiput, which is what we are using most often to landmark how the baby is facing, if you will, head down in the pelvis. Just some more words, basically. Longitudinal is the baby's straight up and down, preferably head down, butt up. Transverse is when it's side, just side to side. Oblique is kind of somewhere in between the two. Longitudinal is really the only way we're going to get a kid out successfully. Fetal attitude, as I mentioned last night, is different than the teenage attitude we catch on to 14 or so years later. Fetal attitude is literally if the baby is flexed or extended. We want the baby nice and flexed in order for all the movements that are necessary to be carried out.
Why
Sure.
would a baby be extended instead of flexed?
It could have gotten caught up on something, like maybe was not presenting properly, like a facial presentation. And when that happens, as the fetus is descending into the pelvis, if it's not this part of the head down, it can get kind of caught up and extend.
Okay.
If it's already kind of in an extended position, for whatever reason, maybe their tone isn't very good, so we might have a compromised kid, then it's not going to come down through the pelvis with the part of the head that we want.
Okay.
So one can lead to the other in both directions.
Okay.
Good question. We talked a little bit, I think this is where this part of the presentation can end. Fetal presentation. The head we call vertex or cephalic. Buttocks is breech, and if it's a shoulder, that's a little more obvious, and that is not coming out the way we would want it. I'm going to stop there for a second because I think this is where we picked up. Yeah.
I had written here the footling breech.
Footling
Oh,
breech.
I
Yeah.
just wanted to make sure I wrote that right. And
Yeah.
that's when the foot comes out.
Right. So butt down, but the leg got down there first. Yeah. And as I mentioned, that I've had patients come ruptured membranes in labor with a foot hanging out of their vagina. Yeah. Usually they are preterm, so the baby hadn't had a chance to get into birthing position, and that's what comes out.
What is it called?
Footling breech.
Does breech always mean C-section, or can you deliver a breech baby?
You can deliver a breech baby. That's a really good question. The issue is, as I might have mentioned last night, biggest and most difficult part of the baby to deliver is their head through the pelvic opening. That's the most immovable, biggest part of a baby is the head. So a lot of doctors, most doctors now refuse to deliver a baby breech because they don't want to get the majority of the baby out to find out the head won't fit. That's a nightmare scenario in terms of now what?
Gotta push it back in.
Got to push it back in and go to C-section. It adds, it's certainly a whole lot more risk for cerebral palsy and different birth injuries delivering breech. If you are going to deliver breech, you want the old guy. The old guy coming in for the retirement luncheon who happens to be on labor and delivery. Old guy meaning the old doctor, because they deliver breeches all the time and they're more comfortable with it. There are certain things you can do. I've delivered a couple of breeches, but much more preterm, which is easier in that they're smaller, right? It's still scary as heck. You have to reach in as the baby's coming out. You have to reach all the way in and grab your fingers into the baby's mouth and keep their neck flexed. Yeah, you want to tuck their chin to their chest because if they extend their head as you're trying to get it out, it can be tough. Yeah, so there's a whole bunch of things, and so they rarely will deliver a breech on purpose. Some doctors still will, particularly, I don't know of any doctors, I don't know all of them, who will deliver a breech if they have documented that they've delivered a much larger baby than predicted vaginally. So if it's their third baby and they had a 9.5-pound baby, this baby's slated to be 7 pounds, they might say, well, this head is going to fit through the pelvis. So there are some doctors who will agree to do a breech, but they get a lot of flack for it, I think, from other people, just because the risks are higher, plain and simple. But I think what they're doing is keeping their patient's best interest or their wishes in mind. So it's not like they're doing something intentionally to be harmful. They are trying to prevent a C-section for a woman who really doesn't want to have one. The risks are just way too high, in my opinion, and in the hospital administration's opinion, because they're liable for whatever happens, I would say.
I don't understand this slide, so.
Sure.
Military,
All right, so the first thing we got going on is it head down? Cool, it's a head, great. But there's more to the story, because a head can present in the pelvis in a couple of different ways.
okay.
The vertex is the top of the baby's head, we're okay. That's what's coming down first. We know we're in a pretty good setup, all right? But if it's military attitude, that baby's neck is extended, and as it's coming down into the pelvis, it might flop back more and cause some trouble. So the military attitude is like a soldier standing at attention, as opposed to the chin tucked down, which can cause trouble.
Is that the top picture? Is that?
This is military attitude.
one.
That's what I
Yep.
couldn't find,
Yeah.
okay,
Yeah.
that's military, okay.
So it begins in a military attitude and will probably shortly thereafter go to brow as it's coming down and the head is still extending. The brow will then present and then full on face presentation, which is very difficult to get out.
Is that because you can't, like,
It's just,
Where the head is.
it's just the widest part of the baby's head is not lined up with the widest part of the mom's pelvis more than anything. I mean, face presentation babies have been delivered with a big bruise on the face. Yeah, because that's the part that's getting the most pressure put on it. It's just not, it's, you know, I'm sure it increases the injury to the baby.
okay.
If not some bruising.
Still, I'm sorry, I just like,
That's okay.
I'm trying to like figure out.
Sure.
how-
It doesn't
So
mold then.
does it, I was
doesn't
gonna say,
mold.
so
Correct.
there's no molding.
Right, the
Yeah.
face doesn't mold,
Yeah,
the skull
mold.
does.
Okay.
Got it.
Yeah, that's
Okay.
probably the best way to
Yeah.
explain it.
Okay.
Thank you.
Alright, no, I'm
We're like,
sure
"Ah,
it's
you
like-
just
The
trouble,
head's gonna mold,
trouble."
But the face probably stays like that.
Yeah,
Right,
which is
okay.
probably why all the bruising.
Great, okay.
I don't know if, I hope that the slide after this included my story about the facial presentation. I'm gonna have to look, because I think this is where we started the next,
Yeah, I think you're okay with the,
yeah, from here on. Hold on just a minute.
you did the fingers.